All right, so thank you for the. Oh, this other guy. Here. No, still not doing it. Okay. There we go. Okay. All right, so thank you for the music examples. Here's my critique. I did listen to everything. I don't know who gave me Never Enough. I do enjoy Hugh Jackman. I was in theater in school. I could appreciate it. But since I never actually saw it, it was kind of out of context for me. So, I mean, it was okay. I gave it a 3. I'd probably like it more if I was like in it, you know, or knew it better.
You can watch the movie.
Okay, I'll watch the movie. All right.
And then you'll understand.
Okay. Got it. Fair enough, fair enough. That's why it has potential to go up. Seeds, I got points with my daughter for this one. She likes Folklore. Gotta say, I actually really liked it. Whoever likes that one, if you don't already, you should probably listen to Conan Gray. Who is that? Who is Folklore? Do you like Conan Gray? There you go. He's the person he's my goal to like get the next person to come in and like speak, but I don't think it's gonna happen, but I'm trying. Lost, I'm sorry, I just can't get into Frank Ocean. Like, he kind of has that same Sam Smith, boring, I hate my life thing. Who was that? Sorry, Grace.
It's a him.
Yeah. Cherry Colored Funk, that went back. Somebody in here is like a throwback person. Who that? I'm impressed with that. That was like, kind of like in the same like new wave thing with like Human League and stuff. I thought I remembered them more like new wavy, but it was still pretty good. My suggestion was Annie Lennox, if you know. Kind of Love. I hated it the first time. I liked it better the second time. I might like it better the next time. I gave it like 3 stars. I would say like if you like that one, maybe Evanescence. Who is that? You ever listen to Evanescence?
Yeah.
Okay, cool. Yeah, like I'm right on here. Down the hole. Like I thought I knew this one, and like Alice in Chains is like clearly really good. But like when I listen back to it, I'm like, this was not one of my like favorite Alice in Chains songs. But clearly you get credit for having good taste. Was kind of my thing. So who is Alice in Chains? Somebody's not here, I'm guessing. All right. Stay Close. I actually had a hard time finding this one. I had to like YouTube it. I felt really bad for this guy. I said I think he might wind up actually murdering the girl that doesn't love him, and then like preserving the body in like a case or something. Because he like really creeped me out. Like I gave it 3 stars because he like scares me, and I don't want to like
Actually, the backwards. He's singing about someone who's like already gone.
Oh, okay.
Yeah.
Okay. Well, yeah, he's already gone. Probably because he killed her. I'm just saying, he definitely needs therapy. Which is funny because when I first saw it, I thought it was SMYL, and I thought it was like an acronym or something for like smile. And then I saw it, and I was like, "Oh, this guy's not smiley at all." But hey, it had that really sad kind of vibe. Look Out. This one was kind of like, it was like Seeds, but not as good. Like I just was kind of like so-so on that. Peach Pit. Who was that? Yeah. I mean, the name was cool. The name was like a reference to 90210. So, Scarborough Fair, classic song. I figured this was somebody that either sings in the chorus or music major or somebody. No? No? I guess it was maybe one of the people that's not here. Yeah, I mean, like, you can't really go wrong with Simon and Garfunkel. Forrest Black, dude, I loved everything about those 2 songs. He always comes up in my suggested music, and I think it's probably because of Callum Scott and Damien Rice. So who was You My Forrest Black? That was awesome. That was really good. So that one I added, and then who was which one of these was, I don't know, 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 I feel like I'm missing one. That was the one I said. There was another sad one, and it was by somebody who I actually had a song on there from. I can't remember it now. Did somebody give me one that I didn't do? I'm trying to think. It was by somebody who also sings a song called Jealous, which was also super, super depressing. And I forget what it was, but I forgot to put one up. So yeah, in general, thank you. I feel like you guys have pretty good taste. I enjoyed a lot of it. I do wonder, if you guys are a little depressed, or maybe I need to write some things for the counseling center. I don't know, but hey, it's cool. I listen to them in the car, and it was kind of fun to ask Alexa to give me these guys. All right, so that takes us to chapter 3, seeking healthcare. So this is one of the things when the book got updated, I like the fact that it added this in here, because the old book didn't really talk about actually going and getting treatment, so it kind of is important if we're talking about health psychology. So there's a whole chapter on it, which I think is cool. My question for you guys: when would you go seek medical care? That's not a trick question. This is I know everybody has kind of a different threshold for when they go to the doctor. I know there's some people that they have a sniffle, they're right on the phone. There's some people like my wife who broke her foot while she was out one night. She came in, I literally watched her crawl across the floor, and I was like, I don't know, think we should go to the ER or something? She's like, nah, I'll be fine. So she walked around like this for 3 days. I was like, dude, we gotta go get the foot looked at. She didn't break her foot. She ripped 3 tendons in her foot, which actually wound up being worse because it took longer to get better. But everybody's different. What does it take you guys to go to the doctor? Yeah.
Probably 2 weeks, if I'm still there when I go.
2 weeks. Okay, that's good. So that way you don't wind up going and having them say, oh, just come back in 2 weeks if it doesn't go away. Yeah. That's the antibiotic rule. Or you could go in 1 week and tell them it's been 2 weeks. What else? What does everybody else do? Or have you not been to the doctor in a long time? No. So, yeah, Brie.
I just think that if it's anything out of the ordinary, I'll go, but it's just a sniffle, I just
Yeah.
pump it out.
Yeah. So you find a growth on your shoulder, yeah, you go in, but yeah, makes sense. Okay. So, and that'll come up in a little bit too, kind of what constitutes getting treatment, when do people get treatment, what do they kind of wrestle with when it comes to doing it. I think I brought this up in the very beginning, but it's here again just to say, when we talk about health, health is more than just the absence of disease. It's also the positive physical, mental, and social well-being. So for somebody to be healthy, it doesn't just mean that they don't have disease, it means that they are well in other ways. And to that effect, there's also a difference between disease and illness. And you kind of hear about it, you'd rather have an illness than a disease. But if you never really thought about what the actual difference is, disease is process of physical damage within the body. You can have disease regardless of whether or not it's diagnosed or there's a label. So, you may have something, there's probably people out there that have asthma who never got it diagnosed, or who have cancer who don't know they have cancer yet. And just because it hasn't been made official doesn't mean that the disease is not there. So the disease can be something that is chronic, that's just kind of hanging out in the body. Illness is really more of the experience of being sick. So illness is really more about the symptoms. Disease is more about the thing causing the symptoms. And clearly you can have illness without disease, and technically you can have disease without illness. But when we're talking about them, that's sort of what we're talking about. So when we look at illness and we look at kind of the role that you play, so like when we talk in if I were doing like a family psychology class or whatever, like counseling, we talk about roles. We all play roles. We all are students and sons and daughters and brothers and sisters and teachers and whatever. But there are actually kind of roles that you could play as related to sickness or being unhealthy. So two things to kind of talk about here is that illness behavior is really just what it sounds like. So you get sick, you've got symptoms, you've got a sore throat, you've got a cough, you've got a runny nose, you've got, I don't know, bleeding rectum, I don't know, I'm not judging. But you have the symptoms, you don't necessarily have a diagnosis, and then generally there are certain activities you're going to do, things you're going to do. You might take ibuprofen, you might go to the doctor, you might head to the ER, depends on what it is. The sick role is after you have a diagnosis, whether that's going to the doctor and having them tell you that you have something wrong, or that you kind of figure out on your own, it's what you do with that. And it's kind of a combination of actions and mindset. So, the difference here is when we're looking at illness behavior, that is part of the sick role, but the sick role is more than just that. So, does anybody in here have ever had family members who had a chronic illness? Yeah. So what was? Well, I mean, I don't know what the
I
just.
do.
Oh, you do. Okay.
Yeah. I have fibromyalgia.
Okay. So for people that don't know, you want to explain what fibromyalgia is?
So it's basically like your body attacks itself and attacks like your own joints, so it like breaks down over time. But it's kind of like the end-all be-all diagnosis. So you don't have like arthritis or like rheumatism or anything like that. So there's nothing you can do about it.
Yeah.
You just kind of have to live with it. So basically, I got like a bunch of lab work done to see if I had any like indicators of anything else. So all I really do is take Motrin.
Yeah.
Like that's all I can do.
Yeah, and that's actually a really good example. I'm not glad you have it. I'm just glad you brought it up. So fibromyalgia is basically, it's really an immune system disorder because of how the body reacts to itself, sort of like rejects itself. Love yourself, Lauren. You don't know. But it's one of those things that it's a kind of tricky diagnosis. You've probably encountered a lot of physicians or other people that say it's not even a real thing, correct? Yeah. And then there's other people that are like, hey, no, this produces real symptoms. It's clearly something. And regardless, I would say it doesn't even matter if it's a proven or accepted or ICD-9 disease, which probably does have an ICD-9 code, but it's real for you, no matter what. The symptoms are real. So if you consider yourself as a fibromyalgia patient, sufferer, whatever, what kind of things does that mean for you? How does that make you maybe different from somebody who does not have to deal with that?
Um, so like I have to think about things that like other people don't really think about oftentimes. So like if I know I'm gonna like go on a trip with my parents or something, I have to think about like how much walking around we're doing to like see if my ankles or like my knees are gonna hurt and I'm gonna need to like rest for the day after.
Yeah.
Or what the weather is, just if it's like really, really cold and I'm outside all day, that causes a flare up rather than like, oh, like I have to dress more because it's really cold. It's like, oh, am I gonna be in bed all day the next day?
Yeah.
And like certain things that I eat, I have to watch certain things that I eat.
Yeah.
So it doesn't like like fight back.
Yeah.
Just little things like that like
Yeah.
typical everyday life things that I didn't have to think about before. I have to like pay more attention to detail now, so just like a lot more caution in my life.
And that's what goes into this idea of sick world, which I kind of hate the term because it almost makes it sound like somebody's pretending. That's a totally different thing. This is just how does your body issues kind of change or define, kind of who you are. If you have Crohn's disease or colitis or something, there's one where you have to give some thought to what you're doing. You have to maybe plan a little extra time, watch what you eat while you're out. Maybe Imodium's your friend. Or things like, as you get older, I start to realize that if I'm walking around these 3-day tournaments, I'm 48 now, I'm overweight, trying to work on it, but I know if I'm walking too much, my back is just screaming at me. And like I could feel the nerve, whatever the nerve is, it's like my back goes numb, my leg hurts, my toe hurts, it's just bad. So I know I'm probably hitting some naproxen or something before I go. So it just changes your perspective as you deal with these symptoms. So what shapes illness behavior other than the actual disorder itself, whatever the thing is? So the personal factor makes a difference. Are you somebody that tends to get more stressed, more anxious? Do you have a higher pain tolerance? Is your desire to do something kind of push you past that? It's funny, I look at my daughter who, on one hand, it's like she always has like aches, and she has more aches and pains for a 15-year-old than I ever met in my life. But it won't, like, if you're like, okay, well, you got a game tomorrow, she's like, okay, I'm good. So it's funny. Gender, when we look at healthcare, women tend to seek healthcare more than men. I want to say that's a stereotype, but I think it probably is not. I think it's probably related to women maybe being more practical, men maybe trying to tough it out more or something. But I hate gender examples because I feel like they're kind of iffy. Age is an interesting one. Younger people definitely don't seek out healthcare as soon as older people. But older people will wait until there are symptoms. But when there are symptoms, they tend to jump on it. So there's something we're going to talk about shortly called optimistic bias that has to do with that, with age, why young people don't go get health care. Socioeconomic status, this is just one where people who don't have the same means and resources probably aren't going to go get health care because it's either impossible to get, harder to get, costly. So in no sense am I saying that I'm in this situation, but I can tell you my healthcare plan has a high deductible. So the benefit for me is after I reach $7,000, I don't have to pay anything. I could go to any doctor, do anything I want, get any meds I want, but I have to get to that point. So the first 4 months of the year, I spend a ton of money. So first 4 months of the year, if I'm having pain behind my knee, I'm gonna be like, I think it's all right. I'm pretty sure it's not blood clots. I think it's probably from hockey. I'm just gonna wait a while, take some medicine, see how it goes, because I know it's probably gonna cost me like $1,000. If it's June and I've met my high deductible, and I know that I can go for free to go see the osteo guy and go get an MRI, I'm gonna be like, yeah, sure, take a look. Look at the other leg while you're at it. You wanna look at my arm? It's all good. So a lot of times, how much things cost and how easy they are to get matters. Stigma is another one. This is actually, and this is an interesting one too. There's certain things you probably don't want to go to see the doctor about, you don't want to tell them about. I know, there's some, I think there's a statistic that like all guys over 50 are supposed to, maybe it's over 40, God, I don't know, are supposed to, oh yeah, it's over 40, are supposed to like have a prostate exam. There's only like 20% of guys do that because you're embarrassed. You don't want to go into the doctor and be like, hey, you want to see what's going on in there? So it's like, it's one of those things that people will stay away from it. Or if you have, an embarrassing rash, or you did something that might have caused a problem, you might not want to go in to ask the doctor about it. So that's another reason why we might stay away. And then the other thing is, what are the symptoms? How big are they? Are they something that is causing you an inconvenience? Or is it really changing the way you live your life and causing you problem? The more problem you have, the more likely you're going to go in to actually see the doctor. So as we kind of look at the reasons why we do these things, a lot of it's common sense. I mean, I'm sure I'm not saying anything here that's like blowing your mind, like, oh my God, guys don't like to go in and have a prostate exam. This is not like rocket science, but when you think about the big picture as to why things don't necessarily get treated as quickly or why things progress, this may be wise. There's a lot of preventative things we tend to avoid for the wrong reasons. So how do we as people, as just regular old people, think about disease? How do we understand it? How do we play it out in our heads? There's a couple different theories, a couple different models. The first one is by this guy by the name of Leventhal. So he says, it follows this progression. It's like we identify it. You've got, you've got breast cancer. Then we're going to give you a timeline. Okay, this disease tends to progress fairly slowly. We caught it at an early point, stage 1. Treatment options are good. So we're going to look at if you get treated now, your chances of recovery your prognosis is very good. I would suggest you get I'm pretending to be the doctor now. I would suggest you start treatment within the next 3 months because you don't want it to metastasize. Then, once we kind of identify it, figure out a treatment plan, you sort of take a step back and you look at the cause of the disease. Where did it come from? Was it something that was preventable? Is it something that's genetic? At this point, you've got the disease. We're talking about breast cancer here as an example. At that point, is it important to go back and look at the cause of it, do you think? So Maddie, you have breast cancer. I'm sorry. I hate to be the one to give you that news. But don't worry, we've got you on a good treatment plan. Your lovely hair is going to probably fall out, but you're going to be okay. Would you want to know why you got it? How come?
I'm just curious.
Curious?
I could have maybe prevented it somehow.
Okay. So let's say it's genetic. There really wasn't a whole lot you could have done. This was going to happen to you. You still, why is that still important? Well,
For my kids.
yeah, I mean that's one. I mean, if you know, if you want to kind of have an idea for your kids, so that you are regular about checking up afterwards. If you know it's a genetic thing, what were you gonna say, Sophia?
I just think like some treatments are based off of like the cause, like if it is genetics, like
Yeah.
they like know what gene it is, and they can like tap that gene.
Absolutely. So yeah, so like some will affect the treatment, some will affect your decisions down the line. Maybe you don't want to have kids. Personally, I think it's worth the chance, but you want to make sure your kids get tested. So things like that. Okay, and then we're back into reality, consequences of the disease. So now you know, like, okay, what's the worst possible scenario? And okay, so once we come back from that, and it's like, okay, best possible scenario. And then how's it going to change your life? How's it going to affect you? So we're looking at, 3 rounds of chemotherapy. Generally, you're going to be fine. You're going to be real sick the first week, and then you're going to, by the second week, feel better. By the third week, you're almost going to seem normal, but then you're going to have another round. So you kind of want to understand all of that, because just because you wind up with a disease or a disorder doesn't mean that your life stops, or it should, doesn't have to. So understanding that becomes important, so you can kind of figure out what's what. Once you do that, you now have some control over the disease. You understand the treatment, you understand where it came from, and you kind of have an idea of what, what you're doing about it. How do you have efficacy? So, having that mindset, if you understand your disease and understand your treatment and understand the consequences and know what to expect, how do you think that changes things? It doesn't matter to the course of your illness and your treatment. And there actually is a right answer here. Yeah, Matt.
Can you repeat what, like the question was?
Oh, so like having this understanding, the fact that you understand what your disease is, you understand where it came from, you understand the treatment, you understand the repercussions of the treatment, you understand the prognosis, you understand kind of the overall picture. If you are that way versus somebody who doesn't have all of those pieces, how does that affect your treatment? Or how does that affect your health?
I think for someone who does know those things, it can probably empower them to take control of what they can take control of.
Mm-hmm.
Because I think you generally would feel pretty out of control when you have some sort of diagnosis like that.
Yep.
And it can also help to determine like what type of treatment you want. It
Mm-hmm.
can help you figure out like where you want to go with it, because maybe there's multiple options. Maybe it is like kind of like a terminal diagnosis, and you're like, you know what, I don't want to spend the rest of my life with this, treatment that alters the quality of my life, so I'm just gonna live the rest of my life. Like it's
Yeah.
very individual.
Yeah, and then you have kind of peace over that because you knew all the options.
And I think someone who doesn't know, generally, like, I had an uncle pass away last year, and he had, something happened with his kidneys. He did have, lung cancer, but he had, like, a lot of issues, but he also didn't really, like, care to take care of them.
Mm-hmm.
And, it was unfortunate, because I think he could have lived longer had he
sought out care sooner, but he was kind of not really worried about it.
Yeah.
So I don't know. I also think that the doctors didn't really do a great job with helping him out there. They sent him home when he clearly wasn't okay, but you know what I mean? Like,
Yeah, yeah.
he
So
didn't know, and I think he just didn't really care, and there's like a difference. Some people don't care and some people do.
yeah, and then there's probably that gray area where they might care but they can't absorb it all.
Yeah.
They deny it, or they don't understand it, or yeah. Absolutely, absolutely. And Bree, you were gonna say something too?
Kind of similar, just like, I think knowing is gonna help your, like, mentality just towards everything.
Mm-hmm.
So whether you are going through treatment, having a better mentality towards the treatment is gonna help, like, make it more successful and
Yeah.
effective than if you have, like, a negative, when you're, like, confused or
Yeah.
upset.
And that's 100% true. There's actually research that shows if you have a better mentality towards it and a better understanding, you get better quicker and more efficiently. So the way you think about your disease and your treatment actually changes your physical like reaction to it. And I think a lot of it has to do with the way your body handles inflammation, because we haven't gotten there yet, but when we talk about inflammation, you're going to see that stress causes inflammation. Inflammation causes your body to be like, I'm just going to throw up a red flag that something's wrong, but instead of working to fix it. So inflammation prevents your body from fixing things. Therefore, there's a direct relationship between stress and not getting better. So when you have control, you have less stress, therefore you have less inflammation, therefore your body can do its thing. So when we talk about the sick role, again, there's certain things that people with the sick role, you get some privileges and you have some responsibilities associated with it. It's like give and take. So the privileges, you have the right to, this is like getting arrested. You have the right to make decisions concerning health-related issues. So if you're sick, you get to choose what you do. It's your body. You have the right to be exempt from normal duties. All right, if you're on dialysis, you don't have to go into work every day because, well, 3 days a week you need to be hooked to a machine. You have the right to become dependent on others for assistance. That's a big one that's hard for people to accept that privilege. You know, especially when you've been well-bodied your whole life. When my grandmother had to move in with my aunt, that was the beginning of the end. It was, she had macular degeneration, so she was losing her sight. But if you knew my grandmother's was the house where everybody went every Sunday, every holiday. She was like the hub of the family. When we had to sell her house and she had to move in, I just felt like she was just kind of like, it sucks now. So she was, you know, she didn't realize, hey, it's okay if somebody has to take care of you. You've taken care of other people. Sometimes people take care of you. But when you're sick, you also have certain responsibilities. So you have the duty to maintain your health and try to get well. So, all right, you're sick. We get it. There's certain things you're not going to be able to do. We're going to give you some options. We're going to give you some help. Your job is to try to get better. Don't sit and milk it. You have a duty to perform routine healthcare management. So this kind of is like saying, okay, if you know there's something chronically wrong, you can't just wait and let things get bad. You have diabetes, you can't not check your blood sugar and just wait until you wind up in ketosis in the hospital. And you also have the duty to use as many health care resources as are possible. So again, this is not rocket science. It's just stuff that we don't necessarily think about, as often as we should. So when we actually are looking at getting medical help, there's different things. The first is I like how they call it, the lay referral networks. This is just meaning, hey, before you go to the doctor, almost everybody tries to avoid that by asking somebody else, looking up stuff on the internet. So I have an issue with my leg. I'm going to ask my dad because he was worked at Jefferson for many years. I'm going to ask Newberg, who you'll meet next week, who I play hockey with, who he's my go-to doctor friend. I'll ask Chad, who's my brother-in-law. He's an ER doc. I should be able to rely on him a little bit more, but he really doesn't want to talk about medical stuff with the family, so he's the third on my list. Next, I'll check with anybody else in the family who's had it, any of my other friends who have had it. Just get their ideas, So I have some thoughts, So that's usually where we start when you first have something wrong. Or you can check out a website. You could go to WebMD, and it's you put in the thing there. I've got joint pain, and it tells me I've got the gout. Okay, how would I know I've got the gout? Anybody know how you got the gout? It's like when your toe hurts. It's like a really bad toe pain. What's the pitfall with, what's the negative to going to a website or something and plugging in your symptoms? Yeah.
There are many symptoms that are similar across a wide range of different illnesses and diseases.
Yeah, that's a big one. So yeah, you got toe pain, that's pretty specific. If you've got a cough, lots of things have that related. So yeah, what else? So I put in pain behind my knee into WebMD, and it gives me tendinitis, some other thing I can't pronounce, and DVTs. And I'm okay, let me look up what these things are. DVTs, that could cause a pulmonary embolism. I could die tomorrow. That's how you start freaking out, And it's sometimes WebMD can make you kind of paranoid. There's only one person in the room that'll understand this one. If you've ever taken a shot to the boys, John, don't ever look up testicular torsion on WebMD, because that'll freak you out, because you'll be oh my God, if I don't get to the hospital within 2 hours, I'm going to lose them. And then you start wait a minute, how do I know if that's what it is? Do I even want to debate if that's what it is? Is this worth a debate? And, next thing you know, you realize you're fine. It wasn't really that, but, beware of websites. So we're halfway through. We'll talk about receiving care in a minute, but we'll take a short break here and set these damn things up. You have to go. It's to go from this screen to this screen. You literally have to. There's a tiny little imaginary tunnel that you have to make your mouse come down in order to make it work. It's crazy. All right. Oh no. I have to get on this. so my question for you today, I really enjoyed the songs. Today, you can text Jeff Dunn 115 to 37607, and then you can text me a question, any kind of question. You try to stump me with it. If I get it right away, I get all the full points. I don't know what these points will buy me, but I'll get all the points. I get half points if I can get it to you within 24 hours. If you stump me, I owe you points. So I'll give you 3 points to whatever your lowest grade is. So there's real stuff on the line here. So when you text me, mention who it is too, so I know whether to, or I guess you don't have to, I could ask you after the fact. So, and I think you could also get in at that pollev.com/Jeff Dunn 115, whatever is easier. You can either text or get on the website. I wonder if I can make this larger. Nope. Name it, all right, Tom. Can't wait to see questions. Stump me with, I don't know, pop culture, movies, history. It can't be like, what did I eat for dinner last night? Because that's a cheap answer. I won't go for that. It's something that I could look up if I wanted, but I won't. What's the capital of Tanzania? I don't know. Does Harry Styles wear boxers or briefs? That would be kind of messed up if I knew the answer to that one. Has anybody tried sending something? Make sure it's going through.
It says you did not open the folder.
Oh, I didn't do that again? God damn it, Jeff. Maybe it's because I need to do this, present? No. Oh, there we go, I guess, it said it deactivates, so, yeah, it should have worked. There we go. What's the name of Kim Kardashian's makeup? World's smallest country? Oh, I know that one. Oh, Kim Kardashian's makeup artist. Oh dear. World's smallest country. That's the Vatican. Vatican City. French translation of the word squirrel. Oldest Disney movie ever made. Is that Steamboat Willie? I think. How many albums does Taylor Swift have? Well, more than 9. She's probably up to like 11. What's my favorite color? Boo. What's the meaning of life? I know that. I'm just not gonna tell you. Rarest M&M color. I'm gonna go with like tan, or like blue, maybe. I don't know. Where does the thought go when it's forgotten? Ooh, either that's really deep or that's a reference to like the Pixar Inside Out movie. I don't know. Interesting. First instrument created. Ooh, that's a good one. Huh. What can you hold without touching it at all? Oh, that's a riddle. Is that like air? My heart? I don't know. Something stupid like that. Hold. Who hold without touching it at all? Huh.
You can get that one.
Alright. I'll give some thought to it. If people want to continue thinking of things, you can keep sending them in, and then I'll do like what I did before, and I'll come in with my answers. I won't look anything up. I'm going to be on the up and up, and then I will keep my promise. You'll get points if you stump me. So, now we're talking about receiving medical care. Okay, so we talked about kind of what it is like to have illness, kind of what gets you there. Once you actually get there and look for it, what's the deal? First thing is that it's really hard to get good treatment without health insurance. If you want health insurance in America, what do you need to do to get health insurance? What's that? Pay a lot of money is one option. What's another option?
Like have like a higher job, like a job that covers health insurance.
Yeah, have a job that has benefits, probably the easiest way of getting health insurance. Any other ways you can get health insurance in America? The other way is if you are disabled, you can usually get some kind of Medicare, some kind of Medicaid. If you're old, well, I shouldn't say. I gotta stop using the word old because like the closer I get to 65, I know I'm still like 17 years away, but the closer I get, I gotta stop using that word. But at a certain point, you can get Medicare. If you have certain disabilities, you can get other insurances as well. So some of the possible problems, even though those are the ways of getting it, there's 11%. It's probably even bigger than that, and it's probably more like 13, 14% unemployment right now. So some people don't have the option. You don't have a job, you don't have benefits, you don't have insurance. Some people have jobs that don't offer benefits. A lot of hourly jobs, a lot of tip jobs. Definitely kind of like any under the table job. They don't have benefits. Selling drugs, don't have benefits. Even some job insurance has limits. Here's a terrible story. Company I used to work for, my manager, who has become a good friend of mine, probably the best boss I've ever had. His son had scoliosis, and I think had to have like 20 operations in order to get his back all straight. And we had very good health insurance. They paid for everything. He found about 6 months later, he got fired. They told him, you got fired because there were complaints about your performance. He says, complaints about my performance? This is the best we've ever done. Everybody that works for me loves me. Everybody that I report to loves me. Not jiving. So because everybody loved Glenn, an IT guy intercepted an email, passed it along to him, about how the top 5 people in the company who used the most insurance money for the year were let go. Well, I'm sorry, 4 of the 5 of them. Because it wound up costing the company a crap ton of money. Needless to say, they went up in a really nice lawsuit. Glenn got a lot of money from them. But, you know, that's messed up. You pay into your insurance, and you know there were issues there. Some places, some insurances, you can only use up to a certain amount and then it stops. Dental benefits, you know, you have like a year of braces, man, that ruins you. Another thing that you see is medications. My daughter used to be on Concerta, but she couldn't take pills. So we had like a patch that she used to wear, like it's like a nicotine patch, but for ADD. And the insurance company's like, we don't cover the patch. And the doctor's like, she can't take pills. And they're like, tough shit. So, you know, there's certain problems. And actually, medical costs are probably the biggest reason for bankruptcies in the United States. People just building up all of this medical debt. In 1965, two programs were created to help, at least in some cases. Medicare was meant for hospital expenses for people 65 years and older, and if you pay a little bit extra, you can also get medical insurance. So a lot of your grandparents, maybe some of your parents, depending upon how old they are, could be on Medicare. Medicaid was meant for people with low income who don't necessarily have jobs but have physical problems. The government will pay for their medical stuff. However, if my Blue Cross Blue Shield, if the doctor has a bill of $1,000, my Blue Cross Blue Shield will probably pay, I don't know, $500 of that. The other $500 they eat. If you have Medicaid, Medicaid will pay about $100 of that, and then the other $900 they lose. So if you're a doctor, how is this creating a problem, this system of Medicaid? And okay, since I gave you breast cancer before, Maddie, I'm now going to make you a doctor. Okay, I'm making up for it.
Thank you.
So you're a doctor, and Maya comes into you and she's got Blue Cross Blue Shield. Catherine comes to see you and she's got Medicaid. Are you like cool with that? Or is it gonna change what you do, or?
Shouldn't.
It shouldn't, but. Sorry, Catherine. I'm sorry, you're just a lot of times what you're gonna see in reality is doctors won't accept Medicaid patients. So there will only be certain doctors you could choose from. And a lot of time those doctors will be overly crowded because anybody who has no other options are going to them. A lot of times they're not the best doctors because the best doctors could be like, hey, I'm good enough that I'm going to not accept that because I could do perfectly fine. I'll have enough patients the other way. If you ever want to see the best doctors, go to the ones that don't take any insurance, because they're like so good and so cocky that they're like, hey, look, I don't need any of this. I want to get all the money, so I only take people that are paying out of pocket. They're usually pretty good doctors. But it makes it really hard for a lot of people to get the treatment that they need. The other thing is, you know, we have to figure out who do we want to go to. It's not just doctors. You can go to midwives, you can go to nurses, you've got nurse practitioners, you can go to pharmacists, you can go to PT, psychologists, chiropractors, dentists, nutritionists. It's so funny. It's like you could see so many different people. You could, bless you, you could sign up to go see the urologist, and then you get like a PA. And you're like, okay, are you okay giving me what I need? And you just have to kind of figure out what you need. Sometimes you need approval to go to a certain person, and then you have to go to see your regular doctor to get approval to go to another doctor. It gets very complicated in a lot of ways. If you don't have health insurance, you probably don't have a regular doctor, and then it makes it hard when you have a specific issue. So, you know, no, I'm not gonna use that example, because that was truly an ER thing. Let's say you've got really, really bad diarrhea. It's not really an ER thing, but it's something you might wanna go to your doctor for. But you don't have a doctor. But you wanna stop, like, pooping your pants. So you might go to the ER, which is what a lot of people who don't have insurance do. So why is that potentially a problem when people are treating their regular ailments at the ER? Yeah.
Beds are filling up that don't need to be filling up.
Yes.
Because there's actually people who have like a true medical that need a bed, and
Yeah.
there's beds for patients who can just go to a regular doctor and get
Yes.
it taken care of.
Yeah. This sounds like somebody who either is a nurse or wants to be a nurse or watches a lot of Grey's Anatomy.
I'm going to be a nurse, but I also work at the hospital as an
Okay.
aide, so I see it all the time.
Exactly. Yeah. And that's the thing. It's like ERs were designed for emergencies. And when people are using it as their primary care thing, it screws up the whole system. So then they come with urgent care. I still don't know what you go to urgent care for. Urgent care is like, I don't understand it. It's not an ER, it's not your regular doctor. I guess it's supposed to be for all that other stuff, but I don't know. Urgent care is weird to me. The other piece of things where there can be problems is the communication between the patient and the provider. And when I talk about that, it's literal, but it's also like figurative. So literally, there might be a language barrier. Maybe you don't speak the same language as the physician. Or maybe the physician speaks with an accent and you can't understand what they're saying. If you don't, you're getting some pretty important information here. If you can't understand it, especially if there's treatment involved, that becomes a problem. And most people don't want to say, what did you just say? And by the third time, now you just feel like you're insulting them. So, you know, that's a problem. Or you could have a doctor who just isn't interested in hearing you. I don't know if you guys are old enough to have been to these doctors yet, but I know I've seen my share of people that it's very clear they are not interested. Like the guy who'll cut you, it's like you see the nurse for a while, you see the PA, and then the doctor pokes his head in, doesn't look at you, asks you like 2 questions that you've already been asked, and then leaves. And you're thinking, this joker just got paid like $800 to do that. That's insane. So you don't feel listened to. They might interrupt often as you're telling your story. They might seem too busy. They might use too much jargon. That's another one. You go in and the doctor acts like you've been through med school too, and you should know when he says, oh, I see that the squamous cell epithelium is looking perforated in the conjunctiva. And you're like, what? So, you know, that's another thing. By the way, that was going somewhere until I got to the conjunctiva. I was basically talking about cancer and then I moved to the eye. I don't know why. So that's practitioner communication. And then there's something about being a hospital patient. So, you know, up till now, everything we've been talking about can really apply both to outpatient, inpatient, sick, disease, whatever. But there are specific things related to hospital patients as well that have changed a lot these days. So, you know, first of all, and a lot of it has to do with insurance, has to do with money, has to do with availability. So we're seeing surgeries, a lot of surgeries that used to require inpatient stay are now done as an outpatient. Some of them you'd be surprised, like you can have some fairly extensive stuff done and be at home afterwards. Hospital stays are always a lot shorter. I think the average, I don't know what the stats are of this, but I want to say The average hospital stay for like labor and delivery right now is like a day, maybe 2, where like it used to be like a few days. Although on the good side, there is better tech nowadays, so maybe you go to that urologist and instead of the prostate exam, best thing you want to see, sorry, I guess this mostly just applies to you, John, because you and I are the only people in here with prostates. If you go to the doctor and he wants to check your prostate and he gets out an ultrasound machine, big smile, because that means nothing's going in you. You're just having somebody look at your thing. So the tech is getting better. And then the other thing is we're more informed, so we're able to ask better questions. We're able to voice our concerns more than we ever used to. Back in the day, it was a lot harder to do that. So that is everything about getting treatment, becoming a patient, what the challenges are, what the roadblocks are. You know, you can't really start to talk about what it's like to experience this stuff and why the mindset matters until we talk about what it's like to get in there and actually become a patient. So that's kind of the point of this chapter and what we talked about there. So any questions or anything? That's a silly question. Every teacher asks that at the end. Nobody ever has any questions, except for maybe they like the kiss ass who comes up afterwards, but you know, I shouldn't say that because now you're not going to want to come up to me afterwards. But I promise if you come up to me afterwards, everybody else, they're not a kiss ass, they just wanted to talk. So, in any event, here's my picture for the day. This is another one that I actually took. I'm super excited. You probably know what that is. Stonehenge. It is as cool as it looks. You can't go up to it and touch the stones anymore, but it's really neat being there.